Hi, I'm Heather Batty, Resort Services and Wellness Manager. I'd like to tell you about a presentation on venous insufficiency with Dr. Joseph Magnant of Vein Specialists of Fort Myers. It will be held Tuesday, April 28th in the Grand Cypress Room of the Woodlands at 4 p.m. He will discuss vein disease or venous insufficiency, which is caused by leaky valves in the superficial veins of the legs. He will provide a brief question and answer session after the presentation along with a free vein screening. We spoke with Dr. Magnant recently at his office about why he is bringing this program to Shell Point and how it will benefit our residents.
We at Vein Specialists believe that patient education and physician education, community outreach in general, is the way to get the message out about what specifically venous insufficiency is, how it affects different patients in different ways, how it presents in different ways. I think that venous insufficiency has been mislabeled, underdiagnosed, misdiagnosed for many years. And it's still sort of a big question mark in many patients' minds. Now, venous insufficiency is not just a disease of the elderly, it's a disease of all ages, although half of our patients are over the age of 65. So Shell Point or retirement communities are a prime location for us to share our information. Venous insufficiency in general, though, is basically weakness of the valves in the veins, and it can lead to a variety of signs of disease or symptoms. So signs are what you can visibly see with your eyeballs, like varicose veins or spider veins or swollen legs or discolored skin. Some of the more serious complications of venous disease are bleeding veins and wounds that won't heal. So those are signs of disease, but I think the take-home message from that is that venous insufficiency is much more than just varicose veins. So if you have those other signs other than varicose veins, you clearly could have venous insufficiency. So those are the signs, what we can see, what we feel are symptoms. And many patients have pretty normal-looking legs. They may have a little discoloration, maybe a little bit of swelling, maybe some spider veins, maybe a few small bulges, but their symptoms are really what have them down, or getting them down. They have achiness and fatigue that's worse at the end of the day. They have nighttime leg cramps or Charlie horse type symptoms that are keeping them up at night. They have restless leg syndrome or symptoms of restless legs that are making it difficult to fall asleep or stay asleep. Or they may be getting out of bed at night to urinate 3 or 4 times. And all of those symptoms, what patients actually feel, can be caused by leaking valves or venous insufficiency. The reason we're bringing this educational opportunity to the residents of Shell Point is to open their minds to the possibilities of what they may have and what may have been missed, or what they may have been attributing to the normal aging process, which oftentimes is not correct. Up until the year 2000, we didn't really have much to offer patients with venous disease. So the majority of my time was spent taking care of patients' arterial problems, which commonly is referred to as PAD or peripheral artery disease. The venous treatment, the vein treatment called sealing, or what we're going to talk about, came out in 2000. So up until then, all we had to offer was stripping. So as to the modern treatment, or the modern evaluation in modern treatment of venous insufficiency, it's not stripping. And a lot of patients are staying away from dealing with their vein issue or evaluating their vein issue because they're still under the misperception that it's a stripping procedure that they'll be subjected to. We offer a procedure called endovenous ablation. It seems like a new procedure to most doctors that aren't in this field and to many patients, but it's not really a new procedure. It's been out since 2000. I've been performing these procedures for patients with vein problems by sealing the veins since 2001, and been in Fort Myers for 9 years this coming June. Just focused 100% on treating patients or evaluating and treating patients with vein problems. So if you have symptoms of nighttime leg cramps or Charlie horses, if you feel as though your legs feel better in the morning and worse as the day goes on in the evening, if you have progressive swelling, fatigue, achiness, and tiredness in your legs. I mean, those are symptoms of venous insufficiency, and you deserve at least to get the knowledge to make the next decision of whether or not to consider a vein evaluation. I mean, venous insufficiency is a medical condition. We're not talking about spider veins that make your legs look pretty. We're talking about identifying underlying problems in the veins, fixing them by sealing the veins, not stripping them, and then relieving the patients of the variety of symptoms that they may have presented with. Today, since 2000, endovenous ablation, inside vein sealing, putting a small tube into the vein through an IV, under local, in the office, not in the hospital. No blood work, no EKG, no chest x-ray required. It's like going to the dentist for your veins. And with that catheter in place, placed under ultrasound guidance, the catheter is inserted all the way up to the groin, and it basically is used to cauterize the vein closed. So the vein is just basically shrinks down like you would see a strip of bacon shriveling up on a griddle. You're basically cooking the vein on the inside without the patient feeling any heat and very little discomfort. So the time it takes to do that, from the time the patient walks in the door for their first consult, and once you've gotten to the point of coming in the day for the day of your procedure, patients will be here about an hour and a half or two. The procedure itself will take about 30 minutes to seal the vein, and the patients physically walk in, have it done, and walk out. About half of them take a pill to relax them, and the rest just do this under local anesthesia. So it's well tolerated. The recovery is almost immediate. All patients have tolerated it well.
Don't forget to sign up for this presentation in the Grand Cypress Room of the Woodlands on Tuesday, April 28th with Dr. Joseph Magnant. I'm Heather Batty, and I hope you have a wonderful and healthy day.